Hi, this is Dr. Nikki Green from Fort Worth Cosmetic and Family Dentistry. As many of you know, in our current COVID-19 crisis, we as your dental providers are not allowed to see patients unless it's a life-threatening emergency. So unfortunately, many of the things we would consider a dental emergency are not considered life-threatening emergencies under the current very harsh restrictions through April 21st. So I've put a few videos together to try to walk some of my patients through some of these concerning times when we can't get you into our dental office. So the thing I'm going to address today is, oh no, I lost my veneer. So what can we do if we have a front tooth veneer pop off of a tooth, which can happen? This would be considered in normal times a dental emergency that we would quickly get you in the office for, but in today's times that's a little bit harder. So I've got a model here, and it is literally a veneer that has popped off the front tooth of Sam. We'll call him Sam. So Sam lost his front veneer off of this front tooth. Luckily for Sam, it looks like it came off in one piece, okay? Many times it won't, but still the same process can apply, whether it's in one piece or whether it's fractured. So continue through the video and see if it still helps. For front veneers, it's very difficult to use the stuff that you get from Walgreens, Dentemp, or any of those temporary dental materials. What you're really limited to using if you're trying to do this on your own for a front veneer is you're limited to using Superglue. And while a dentist would normally never tell you to never use that, for a front veneer that's about your only choice in these situations. So what I want you to do is I want you to get Superglue, and I want you to use the liquid form of Superglue, not the gel. And I want you to dry out the inside of the veneer really, really well, clean all that out. I also want you to use a Kleenex or toilet paper or something along those lines to also dry your tooth. So you're gonna dry the front tooth very best you can. In the front, you could even use a hair dryer to help you dry it. If you need help holding your lip back, again, use the same thing. Use a little piece of this Kleenex and literally tuck it up under your lip, just like we would do in the dental office. So any of those things can help you try to isolate this area and keep it dry. Once you've got it dried, once you've hit it with the hair dryer to get everything really good and dry, I want just 1 to 2 drops of a very small amount of Superglue to go into the inside of your veneer. And then you're literally gonna place that onto your tooth in a way that looks correct. Once you've got it placed on your tooth and you're holding it with your finger, I want you to bite your teeth together, okay? So you're holding it with your finger and simultaneously biting your teeth together. I want you to do that and hold it there for a good 30 seconds to a minute. Okay, and then once you've done that, then you can peel your finger off, and you may have to peel because it may be semi-stuck with Superglue, but the finger should peel off, the veneer should stay in place. You may have a little excess Superglue around the edges. If you do, take a toothpick and very gently clean around the edges. Don't overwork it. We don't want you to pop that back off. If there is still a little bit of excess glue, don't worry about that too much. Over the next couple of days, as you brush your teeth and as you eat, that glue should come off. Now, if you've replaced your veneer with Superglue, whether you're a patient of mine or a patient of another dentist, you do need to see your dentist as soon as you are able. So we need to see if we need to do something about that, if the veneer needs to be replaced. But that is a way to get you fixed up so that you can go to church on Sunday and without having to come into the dental office. So any questions, don't hesitate to call us. We can walk you through it, but hopefully this video will help. Thanks a lot.